Suppose the patient is having problem in ovulation, we have to check the AMH value. Many women are having premature ovarian failure these days. At younger age itself, many women are attaining menopause. In many places, only the female cause for infertility is diagnosed. 5 basic tests before planning your pregnancy. In diagnostic hysteroscopy, you can visualize the inner side of the uterus, what is the problem, and you can also treat it in the same sitting. You can find out whether the semen count is good, whether the quality. If there is any problem in the semen analysis, then you So when a couple is planning pregnancy, when you are going to start your treatment, before starting your treatment, you have to do certain tests, find out the cause of infertility, and then plan your pregnancy accordingly. This is Dr. Reshma Shree, fertility super specialist and laparoscopic surgeon. So treating both male and female factors for infertility will increase the chance to conceive easily. So finding out the cause of both male and female will improve the chance to conceive. In many places, only the female cause for infertility is diagnosed. Rather than checking male, only female is checked for infertility. The male cause of infertility is not diagnosed and hence not treated, and hence the couple cannot get conceived. You have to do 5 basic tests before planning your pregnancy. First is your basic blood, then is your sugar level, third is your hormone profile, fourth is your scan test, fifth is your semen analysis. So basic blood in sense, we have to check your hemoglobin, your WBC, your platelets, your serology, whether you are having any infection, and after that you have to do your sugar test. If your sugar levels are high, you have to check your last 3 months sugar level through HbA1c test and take your medications accordingly. Then you have to do your hormone profile. Hormone profile in sense, there are certain hormones which are secreted from pituitary which controls your reproductive organs. Those are FSH and LH, and prolactin test has to be done. If the prolactin value is high, there will be anovulation, that is ovulation will not happen as long as your hormone level is high. So prolactin test has to be checked and corrected if it is high. So many women are having thyroid problem. So thyroid is one of the major cause for infertility. So other than these, we have to do a basal scan. The basal scan, we have to check how the uterus is, whether it is healthy or there is any fibroid or polyp or any infection inside the uterus, or if the tubes have infection or the ovaries are healthy. Suppose the patient is having problem in ovulation, we have to check the AMH value. AMH means anti-Mullerian hormone. This gives the current stock status of ovary. So if the stock is less, many women are having premature ovarian failure these days. At younger age itself, many women are attaining menopause. So when we do AMH, we can find out whether the values are good or if it is low. If it is low, we can plan pregnancy as early as possible. So other than these, the women has to do a tubal patency test to know whether the tubes are blocked or if the tubes are patent. So if the tubes are blocked, then we have to go for higher method, ART method, so to plan pregnancy. So in order to rule out tubal block, we can do either SSG, that is saline sonography through scan, or you can do HSG through X-ray. SSG is always preferred over HSG because it is easy to perform and lesser complication than HSG. So if there is any block in the tube, this is only a screening method. You have to confirm it with diagnostic laparoscopy and hysteroscopy. So diagnostic laparoscopy and hysteroscopy are gold standard diagnostic methods. So in this method, you can directly visualize. There is a panoramic view of the uterus for the surgeon. So they can see the uterus, how the tubes are, how the ovaries, and we can do the treatment at the same time. If there is any problem, we can diagnose. At the same time, small problems can be treated at the same setting. And in hysteroscopy, many open surgeries, we cannot find out what is the problem inside the uterus, or we cannot treat it through open surgeries. In diagnostic hysteroscopy, you can visualize the inner side of the uterus, what is the problem, and you can also treat it in the same setting. So other than this, regarding male, you have to do semen analysis. You can find out whether the semen count is good, whether the quality, that is the morphology and the motility is good. If there is any problem in the semen analysis, then you have to do male hormone profile. In male hormone profile, we will be checking FSH and LH. So, these are also same hormone like female, it is secreted from pituitary which controls the male reproductive organs, and then testosterone level has to be checked and thyroid test has to be checked in male. Thyroid hormone is very important to maintain the quantity and the quality of sperm. So, if the sperm count is low, you have to go for a karyotyping test and go for a genetic analysis. Other than that, you have to do a Y chromosome microdeletion. In case of female, if the egg stock is very low, you have to do a genetic analysis, a karyotyping must be done and find out the cause for early menopause. So, today in this video, we have discussed in detail what are the tests you have to give importance and do it before planning your pregnancy. I hope this video was useful. Please comment, like and subscribe our channel. Thank you.